we're going to finish up cutaneous mycoses with an illustration for the dermatophytes, which are responsible for the various types of rashes called tinea. So dermatophytes are the fungus itself that colonize the skin, and tinea is the disease they cause. There are 3 types of dermatophytes we're going to be talking about, and there are multiple types of tinea as well, but all types of tinea are basically the same pathology, just named differently by the location it affects. So you should by now be closely associating tinea infections with dermatophytes. Now we're going to throw in one more association for you, so that we can tie in a whole story. When you hear tinea, think Tin Man, as in the Wizard of Oz. That's right, Toto. We're not in Kansas anymore. We're in dermatophyte country. And we're going to learn everything we need to know about these low-yield bugs, but I promise there are some facts in here worth knowing, so don't go tapping your heels just yet. Before we start, let's briefly mention the specific fungi included under the name dermatophytes. There are 3: trichophyton, epidermophyton, and microsporum. Knowing the individual types is not very high yield, but we will illustrate them as 3 little munchkins seen here, with a T, an E, and an M on their chests. They're naked because they're dermatophytes and they live on the skin, so they're showing you some skin. Dermatophytes, literally from the Greek, means skin plants, so that will help you remember that they plant themselves on the skin and rarely ever actually invade. Now, the Tin Man is going to represent all the various types of tinea. Tinea is commonly referred to as ringworm. In fact, the word tinea comes from the Latin meaning worm. If you speak English, then you can probably figure out the Latin for any of the tinea species and know what they infect. And we'll go over the various tinea by illustrating them on the Tin Man. We'll add rings of rust on the infected areas of the Tin Man's body, and these rings of rust are meant to look like tinea infections. And you can kind of understand why people call it ringworm. So let's start from the top with Tinea capitis, which is on the head and scalp. And caps are also on the head and scalp, so that's an easy way to remember that. Then there's Tinea corporis, which is on the body. Corpus is Latin for body, like corpse is English for dead body. Here you can really see these ring-shaped lesions that earn the name ringworm. Next we have Tinea cruris, which is on the groin. If you can recall from anatomy, the crura is the structure that attaches the base of the penis to the ischiopubic rami, and this is also referred to as jock itch. And lastly, we have Tinea pedis, or athlete's foot. I'm sure that's an easy one to remember. So who are at risk for tinea infections? Mainly athletes, hence the name athlete's foot. Specifically, think of swimmers who walk barefoot in locker rooms, and wrestlers who have a lot of body contact with other sweaty wrestlers and mats. To remind you of athletes, we've drawn an athletic headband on our Tin Man. Animals, like pets, can also be a source of transmission, especially in younger kids, so let's draw in Toto behind the Tin Man. Finally, these lesions are pruritic, which is why we have the Tin Man scratching himself. Diagnosis of these fungi are pretty easily done by a good history and physical. However, it can be confirmed by seeing the hyphae on KOH prep of skin scrapings. KOH is a salt, so we'll have our little microsporum munchkin sprinkling the Tin Man with our KOH salt shaker. Another form of diagnosis is through the use of Wood's lamp. However, just keep in mind that Wood's lamp is only used to diagnose microsporum. I know I just said that you don't need to differentiate the 3, but this is maybe one exception that you may need to know. To represent Wood's lamps, we'll draw in some lamps in the woods. So these are our Wood's lamps, and you see that they're also up here in the tree with microsporum, which will help you remember that they only illuminate microsporum. Okay, let's wrap up with treatment. The mainstay for tinea infections are topical azoles like clotrimazole. And what was the symbol for azoles again? That's right, it's pine cones. So let's draw in our pine cones in the trees. Wow, they're actually where they're supposed to be for once. So that's the treatment for tinea infections. Dermatophytes, however, can also infect the nails, and this is referred to as onychomycosis. And these nail infections will be represented by the Wizard of Oz, which is actually his nickname. His birth name is really the Wizard of Onychomycosis, and you'll see we have him here peeking nervously through the trees at the Tin Man as he's biting his nails. Now, treatment of onychomycosis is actually a pain and often requires oral medication to be successful. Notice we've made the wizard wearing a turban, which is supposed to remind you of the oral antifungal terbinafine. Terbinafine for turban. For any tinea infections that are more severe, or nail infections that just won't go away, you can step up the antifungal treatment with oral griseofulvin, which is perfect because it likes to deposit in keratin-containing tissues, such as skin and nails. To remind you of griseofulvin, we're going to have our wizard here holding a can of grease. Just the right treatment for a rusty tin man. Grease for griseofulvin. Griseofulvin has a lot of GI side effects and isn't really well tolerated, which can be intuitive for our grease mnemonic. If you eat a bunch of greasy foods, you'll have plenty of GI side effects. And that wraps up tinea and the dermatophytes. Kinda sounds like a band name. Alright, see you next time.